A epidemiologic catchment area community survey was done. It's one of the largest investigations into the prevalence of mental disorders. And from that, they were able to determine sort of what happens with those diagnosed with generalized anxiety disorder. So obviously, emotional health is fair to poor. A lot more people are on disability. A lot less people are working full time. People are more likely to miss 1 week of work per year, earn less than $10,000 per year, have a lower occupational level, and an increased risk in suicide. Health symptoms aren't looking so good either, because people with generalized anxiety disorder are more likely to have asthma, chronic pain conditions, IBS, heart issues, and they're also the heaviest users of primary care, specialty clinic, and emergency room facilities. So imagine having all that chronic daily worry. It makes sense it's going to mess with your interpersonal relationships. So a lot of times there's tons of worry over the relationship. People are more likely to perceive social threats in the environment. So, there's just scanning the environment and taking in, or, what they perceive to be negative. There's going to be a lot more marital discord and dissatisfaction. People are more likely to have meshed relationships or engage in role reversal, where, for example, the child becomes the adult, the child. And also the perception is going to be off. So they're going to perceive themselves as having more of a negative impact on others. So again, it's just a lot of turmoil in terms of interpersonal relationships. So as we know, with most disorders, the causes are just this very complex interplay between genes, biology, environment, personality, and I'll get into a little bit of detail in the next few slides. So people are more likely to get generalized anxiety disorder if they sort of have it in their genes. So they've done twin studies, and they found that 30% of variance has been due to heritability. Traits and temperament make up about 30 to 40% of that variance. So traits like neuroticism, negative affectivity, and anxiety, or an anxious temperament. And if you've got a first-degree relative, definitely increases your chances as well. Personality definitely increases the risk of developing generalized anxiety disorder, and you can kind of read down the list, and it makes sense why. People that are perfectionists, negative self-image, difficulty making friends, the other personality traits on the list, it's definitely increases your chances. Although nothing really specific has been identified in terms of the environment, what the environment makeup and how it might impact development of generalized anxiety disorder. There are studies that show that just childhood adversity in general, stressful, childhood upbringing, and parent overprotection definitely increase chances. Generalized anxiety disorder is definitely comorbid with others, and you can kind of read down the list there. The 4 main types include dysthymia, major depression, social phobia, panic disorder, and mood disorders are a big piece of that. As you can see, personality disorders and alcoholism or substance abuse as well. And comorbidity can occur at the same time, so maybe you have generalized anxiety disorder and major depression at the same time, but it can also be sequential. So generalized anxiety disorder can either be before another disorder is diagnosed or after, so it can be in a sequence as well. If you have a comorbid disorder, it's definitely associated with much more impairment, and that makes sense. And it's also going to reduce the likelihood that you're going to go into remission on your own or just naturally without, intensive treatment. And if you have comorbid interpersonal factors such as marital tension or personality disorders, this is going to really impact your treatment. So there's much more negative outcomes for CBT treatment a higher dropout rate of any kind of treatment, and again, as mentioned before, a reduced likelihood of any remission. Young children are also likely to have comorbid separation concerns as well as ADHD, and then older children are more likely to have major depression and then those specific phobias. There are a couple of interesting models I just wanted to briefly touch on about how generalized anxiety disorder might come about. Clark and Watson's tripartite model of emotion is one of them. It actually explains all the various forms of anxiety disorders. And for generalized anxiety, it really stems from that negative affectivity. And with that, you can also, when you have negative affectivity, you also have that physiological hyperarousal that can happen. This is more associated with panic disorder, though, but you can still have it with generalized anxiety disorder. Vassey's developmental theory is interesting, and it makes sense with the research. So it's generalized anxiety disorder is more prevalent in older youth. This is probably because the older you are, the more you're going to worry about a topic, just based on the fact that you have more experience and more knowledge. And also with age, you have a better ability to elaborate cognitively on worry. So again, your brain's been developing and growing and learning, and now you're better able to use it. Unfortunately, with anxiety, it's not going to be the best. I also really like the conditioning learning theories. So it's classical conditioning. You have your conditioned stimulus, a pan, paired with an unconditioned stimulus, say fire or heat, and you get your unconditioned response. So the anxiety response or the fear that comes from that. Then over time, as soon as the child sees that pan, they're going to just get that conditioned response. They're going to have that anxiety response just from looking at a pan. We're all familiar with operant conditioning if you've taken database, but basically you've got your antecedent, so say a dark room, and you have your behavior, the worry response, and then you've got your consequence. And the consequence can include a parent removing you from that dark room, giving you, showering you with affection and taking care of you, reassuring you, and that's really great. But this theory is saying that that's just going to influence or reinforce having an anxious reaction to things, because if I act anxious, if I'm worried, my parent's going to remove me from the situation and take care of me. So what does this all mean for school psychologists? We're going to go through a series of steps of what you're probably going to encounter in the schools. And the first part, step 1, is the referral process. So most likely you're not going to see these children yourself or out in the school setting. It's going to be a teacher, a staff member, or a parent that's going to refer a student to you. A lot of times they might not be doing well in school because of their worry, so they might appear as just performing lower than typical. Also, a lot of times they might be crying or be afraid to do things in the classroom. They might have a lot of physical symptoms, so stomach upset, headache, things like that. Miss a lot of school from that. So that's probably where you're going to get your referrals from. Step 2 has to do with assessment, and it's first important to note that generalized anxiety disorder is overdiagnosed in children, so just keep that in the back of your mind as you're assessing. And you may want to do a pre-screening first, and you can work with your administrators to sort of set up a school-wide screening process so you can target students that might need a more intensive second-level screening. And you're going to want to look and focus on the intensity of the symptoms, severity of the symptoms, and the function of the worry. And you also, we're not going to diagnose based off the DSM-5, but we will need to keep in mind the special education criteria, and there are 2 areas that you're going to look at. So emotional disturbance is one, and other health impairment is another, and this will just depend on what your assessment findings are. So in terms of how you're going to gather the data, you're going to want to start out with a questionnaire, and these are great for a screening just to see if anxiety is in fact the true concern of whoever referred the student. And there's a number of them, and I'll point them out in a little bit. You also may want to give a clinical structured interview that kind of digs deeper into what's going on for the student, what exactly are their worries, how often are they worried. It just gathers another level of data. You can also go into the classroom and observe. There are some very structured observational methods, but most likely I'll just go into the classroom and do some sort of time sampling to see if their worry is causing them to be off task, or some sort of anecdotal as well. You most likely will not be gathering physiological data, but it's important to know that other, outside clinics might, so they might gather, the level of sweat the student's experiencing when they're anxious, or their heart rate. And so just to keep that in mind when you're reading outside reports. Our main focus will be developing the case conceptualization, also known as a functional assessment. So really just gathering all the background information, talking to teachers, parents, interviewing the student, gathering as much information as possible, and really coming up with, what is the problem, what are the hypotheses, what's the function of the behavior, the worry, or the anxiety that's going on, and then from there you can go on to kind of developing an intervention plan for the student. So one of the books went into great detail about all the different interviews and questionnaires you can give, and it was pretty boring. Pretty dry. Not that exciting. I really didn't care to learn all about the variety and validity, although I would like to know, but I would prefer a quick summary of what the key measures are. So I thought this table was helpful, plus we don't have a whole lot of time to go into that. But the first table just lists the 4 main assessment measures used for generalized anxiety disorder, and they're all fairly reliable and valid. And then the breaks it down based on questionnaire, interview, other methods for measuring a variety of anxiety disorders. And it's actually probably a good idea to not just focus on generalized anxiety disorder. You want to screen for all types just to make sure you're not missing something. The classic treatment is, of course, cognitive behavioral therapy. It's been dubbed the gold standard for good reason, because CBT has been shown to have greater improvement than no treatment, using medication, a pill placebo, non-directive therapy, and placebo therapy, and it has really low dropout rates. So this is a great, CBT is just awesome, and I'm going to let a lady in the videos 1 and 2 explain a bit more.
Listen, people who have anxiety disorders will do anything to get rid of these distressing thoughts and feelings. People fear judgment when they're speaking in front of an audience. They panic while driving in their car. And some are consumed with worry about things that haven't even happened. And then there are some people that just know that they've left their doors unlocked. So what do these people do? Well, they avoid. They avoid public speaking. They catch a ride instead of driving their own car. They make themselves sick with worry. They check their locks again and again and again. Cognitive behavioral therapy helps them face their fears, feel the anxiety, and do the opposite of what their brain is telling them to do. That's basically it. That's why I love this treatment. It's that simple. There are 4 things we do in cognitive behavioral treatment. First is some basic education about what is going on in their brain. You know, caudate nucleus, amygdala, hippocampus, that Psych 101 stuff. You remember it, right? Stacy said she felt much better right after this step. So this is what I actually tell clients in their first session. When your brain interprets incoming sensory information as dangerous, it triggers our fight or flight response. And that is an awful feeling. When you act on that experience, your brain learns that it's responded correctly. Unfortunately, you've just ensured experiencing more anxiety the next time you face that trigger, even if it wasn't dangerous. The second thing we ask clients to do is what I call self-monitoring. We ask clients to keep track of their thoughts and behaviors in response to a trigger. There are tons of great worksheets and forms, but honestly, notebook paper works just fine for myself and my clients. When they return to their next meeting, I take the list and we rank the triggers from least to most anxiety-provoking. Then, we take the trigger that provokes the least amount of anxiety because we want them to be successful, and we begin the cognitive behavioral therapy. Specifically, we call it exposure and response prevention. Cognitive restructuring is where we teach clients to really consider their thoughts. We might ask them, what supports your belief? Or how can you be sure that your conclusion is accurate? Now here's the important difference between using CBT for anxiety versus other disorders. Our goal is to create a neutral response, neither promoting a positive statement nor endorsing a negative one. Instead, whatever it is that I may feel when I'm anxious, I can tolerate the discomfort. That's the way I want a client to talk to themselves. Imagine you have a client who wonders, what if I didn't lock the door? The cognitive restructuring is to acknowledge their concern and accept the doubt of not knowing if they locked the door or not. But there is more than just accepting the thoughts. Accepting the feelings that accompany these thoughts is the next step. We do this through behavioral experiments. We purposely expose clients to their triggers to induce and habituate to anxiety. Their self-monitoring list of triggers allows us to begin this with their lowest ranked fear. These behavioral experiments allows the client to go into the feared situations and learn a different response. This is a really hard part of treatment for clients, but when done appropriately, they can learn very quickly. And what should that response be? It's one of strength, learning the ability to stay in the pain rather than avoiding it, and learning how to persevere when every ounce of their being is screaming to run away. When they don't run away, they learn that they are much stronger than they thought. This exciting moment is when your client gains confidence. This is the moment that I love. At this point, the goal is to continue to practice these new skills and to generalize the skills into other anxious situations in their life. Once they've gained their confidence, treatment may end. Sometimes this is in as few as 6 to 8 sessions, and sometimes further therapy is necessary.
Another level of treatment includes pharmacological treatments or medications, and we're not going to be prescribing these in the school setting, but it's important to kind of know what the main ones are out there in case you get an outside report or need to find out what the student's taking. So you've got the BZs, and I'm not even going to try to pronounce the full name, but basically these treat acute anxiety episodes, and they're not really good for short-term or even long-term treatment. The two main ones that are used for anxiety in general are SSRIs and SNRIs, and they have much better results, although still the short-term treatment is about 60% remission for generalized anxiety disorder. So it's much better to combine medication with CBT. So we know that CBT is definitely the way to go when treating anxiety disorders, but what specifically can you do in the schools? So you're probably going to want to provide some sort of individual counseling for the student. And Coping Cat curriculum is just awesome. It's evidence-based, great results, it's user-friendly, and they have Coping Cat for elementary age students and then another one for high school students, so you can do both. And it teaches CBT skills and also incorporates the family into the therapy process. So that's great. Another one, you might want to do group counseling and teach social skills, because a lot of times the interpersonal relationships are difficult for students with anxiety. So group counseling might be good. And the Friends program for children is also evidence-based and gets good results. And then family counseling is another option. So they have CBT family therapy for anxious children, and it's by the people that did the Coping Cat curriculum. So it's fairly similar, but more focused on the family dynamic for all the sessions. You also might want to put on a parent workshop just to sort of educate the parents out there. A lot of them might also have anxiety as well, as we know. Having a first generation parent with it increases your chances of having it. So it would be good to get the parents involved, and helping your anxious child is a good curriculum that you might be able to tailor into some sort of workshop. And then also just putting on school workshops, getting the administration involved, teachers, going over how to refer students, what you might look for an anxious student, and that can all be very beneficial. The fourth step school psychologists will want to do is follow up. And hopefully we're already doing that with all of our different cases, but it's really important to monitor students with generalized anxiety disorder, knowing that they can sort of have these sort of peaks and valleys, episodes of intense anxiety, and then it seems to get better, and then it gets worse. So even though they've gone through counseling and seem to have progressed and have the tools to cope, it's still really important to follow up and make sure another disorder hasn't developed or that their anxiety hasn't gotten worse. And it's also important to look at the secondary gains of the student. So are they getting something from all this worry? Obviously it's really negative and unpleasant, but maybe they think if they don't worry, they're not going to get good grades, or if they don't worry, they won't have the motivation to finish a task. So it's really important to kind of see what's going on and follow up with that student. So we're just about done here, but I wanted to highlight some things that would be important to remember when working with students with generalized anxiety disorder. And I've mentioned these throughout the presentation, but it's always good to kind of bring things back full circle. So the first thing to remember is that people with generalized anxiety disorder neglect the world around them. So it's almost like they're living in their own little anxiety bubble, and it can be painful and isolating. So it's really important to come up with screening procedures to target those kids and get them into prevention and intervention programs as fast as you can. Also, be aware of the changes in symptoms. So symptoms can get better, get worse, so it's just important to keep that in mind. Also know that your client can be inaccurate, especially children, and when you're in that acute state of anxiety, you think things are a lot worse than they are. You think maybe, it has been 6 months of intense anxiety, when really it's only been a couple weeks. So it's important to help teach those CBT tools so that the client can gain a better understanding and awareness of their anxiety. Also be realistic. So don't promise a cure for their anxiety. That's, it's a chronic thing, so it's most likely not going to happen, but you can say, hey, there's hope. I can help you with tools that will help you cope better with this anxiety and the uncomfortable feelings that come with it. Also, it's good to just remind yourself that SSRIs and SNRIs are today's treatment of choice when it comes to medication. CBT is the gold standard, so even if it's not your therapeutic orientation, it's recommended that you incorporate a lot of those interventions in your therapy. Also, we won't be diagnosing in the schools, but we do screen for special education. So you probably want to look at emotional disturbance or other health impairment if the student has generalized anxiety disorder. It's also important to periodically assess for other disorders and at different phases of treatment. Again, identify the secondary gains, what is the student getting out of this anxiety, and that will help you tailor your treatment plan. It's always good to have a multicultural perspective, and even though different cultures don't increase the risk of getting generalized anxiety disorder, coming from different backgrounds will really change the content of the person's worries. So it's going to depend, maybe in America they're worried about, I have no idea, but they're worried about something in they come from another culture, a country, they have a different set of worries. So keeping that in mind is good. Also, don't neglect the sub-threshold levels of generalized anxiety disorder. Those people are still in a lot of pain. It's terrible even if they don't qualify, according to the DSM. You're going to want to help those students and get them into a prevention plan as soon as you can. So the last few slides are just some online resources and miscellaneous resources I've collected for you. And you can click on the links to go to the websites. But basically, they're really awesome and perfect for not just generalized anxiety disorder, but it gives you a lot of great tips and resources for any of the anxiety disorders. Great things for parents and for schools and children and just you as a school psychologist. So enjoy the last few slides of the presentation on your own. If you have any questions or comments or whatever, feel free to email or ask me in class, and hopefully this has not been too boring for you. Thanks for listening.
Finally, there are many complementary therapies that enhance a client's positive response. Family involvement is crucial in situations where the family system plays a role in accommodating the anxiety or where the client has caused family distress. And truthfully, this happens in a majority of the cases. So collaborating with a family therapist is often really helpful. Mindfulness and acceptance-based techniques are invaluable in teaching clients how to be present in their pain, to accept their experience, and not to judge. Exercise, yoga, and breathing training offer a stabilizing component to treatment. For me, some form of exercise is a must, and I share that with my clients. Working with clients with anxiety disorders is amazing and rewarding work. I invite you to learn more about how to improve your knowledge by visiting the Anxiety Disorder Association of America's website, adaa.org. The website is full of great information on new, emerging treatments and research, ways of connecting with other specialists, and a link to one of the most informative and fun national conferences you can attend. Welcome to taking the first step in learning how to treat anxiety disorders. Once you experience the excitement of taking a client through this process and seeing how far they can go, I know this won't be your last.